Hello, my YouTube plastic surgery research family. Today is Monday, March 20th, and once again, I'm bringing you guys any info that I've come across that may be helpful to you all as well as myself in this thing that we call our plastic surgery journey. Today, I would like to talk about a few things, but before I get started, I kind of want to put some disclaimers out there. One, I'm not a medical professional. I'm not a nurse, I'm not a doctor. I am in the legal research profession, as well as this is not a paid advertising for Dr. Tanya Medina, Dr. Altamonte, or My Home Recovery. Just as how you guys are here doing your research on YouTube, it's the same thing I did in order to compile my info to get me to this point of having surgery in the Dominican Republic, and my research does not stop. I pretty much have when I started my research, I pretty much created an Instagram account to follow Dr. Medina, to monitor her work that she'd done and posted daily. I created a Facebook page to and got myself involved in these surgery related Dominican Republic groups to watch or to see if anything was mentioned about the doctor that I have chosen. I've done extensive research on Real Self. I've done extensive research on YouTube. I've reached out to several women on YouTube, on Real Self, on Facebook, on Instagram, in order to compile my level of comfort for the doctor who I have chosen. But before I get started, I wanted to pretty much just make sure that we go through the disclaimers and so that you guys know. So let's get started today. The first thing I kind of want to talk about is pre-health conditions. This is very, very important. Sad to say, over the weekend and last week, I have seen two plastic surgery cases that occurred here in the United States, here in Florida, whereas women have passed away. May God bless their souls, and my heart goes out to their families. But I seriously feel that a lot of women that are choosing to have surgery tend to not be open and honest with their PCP as well as their plastic surgeon about any pre-health conditions that they may have. It is very, very important for you to initially go to your PCP and let your PCP know, be upfront and honest, that you have chosen to have plastic surgery, and then have a discussion with your PCP about it. I did that when I decided to have surgery in the Dominican Republic. What I did was I immediately scheduled an appointment with my PCP. We sat down, we went over all the information that I received from Dr. Medina. He asked me about the drugs, he asked me about Dr. Medina, and he even went as far as giving me a prescription to get a mammogram done, because I did mention to him that I was going to have a mommy makeover. So I think he just automatically assumed that I was going to get my boobs done, but I decided not to. But that was the level of comfort that I had with my PCP, and he wanted to make sure that I was in good health before I went ahead and proceeded to have this surgery that is coming. So please, ladies, I know sometimes you probably, want to look good. You want to make sure that your body's intact, and you choose not to pretty much disclose your pre-existing health conditions with your plastic surgeon. It could be a matter of life or death. So please do not neglect to be open and honest with your PCP as well as your plastic surgeon. I went as far as letting my dermatologist know that I was having surgery in the DR. We sat down, we went over all the meds that Dr. Medina actually prescribed for me. He even sat there and did some research on it. He asked me 1,000,001 questions. He checked my body, certain areas of it at least, to make sure what I was getting done was what she actually, what I actually needed, which I completely respected him for doing that. So please, ladies, just be honest. If it's a situation that your doctor tell you that you're not allowed to have surgery, do not have surgery. Your family, I'm sure, would not want anything to happen to you. And in my opinion, it's just not worth it. Another thing that I wanted to touch base on is post-operative depression, which is also known as postpartum depression. There's many dolls that have had surgery that after, like a few days after, they felt depressed, they felt sad, they wanted to come home, they feel homesick. I'm sure we have all at some point have experienced some level of postpartum depression. Me personally, I've had it with both children. And all I would do is I would just cry. Every single time the baby cried, I cried. I did not know what to do. I didn't know how to control my emotions. So it is expected that this may happen to you all. So just please try your best before surgery to get into the right headspace. Try to get as much supportive individuals as possible to support you on your journey, which is why I always stress the importance of finding surgery buddies. And I'm not going to stop stressing it. I think it's very important for if you're traveling to the DR or to Colombia or even here within the United States and you're doing it alone, you are going to need someone to talk to. There's in many cases you may have individuals whereas your husbands are not supportive, your boyfriend is not supportive, your family is not supportive, but you have chosen to have surgery anyways, or you may just have not told a soul that you're having surgery. So you are pretty much going up against having surgery by yourself. So you may experience the blues after. You may be sad, you may be homesick, you may cannot sleep, you may be lacking you know, the right nutrients, who knows. But please, ladies, if you need for me to create some form of a platform for you guys to be able to connect with other surgery buddies that are going to have surgery, that are going to be alone, so you guys could have company, please let me know and I'll be more than happy to try to figure it out for you all. The next thing that I wanted to talk about is, which I've mentioned before, is the importance of post-operative care. So there is a few companies that is out there, whether they feature their companies on Instagram or on YouTube, and their purpose, or what the purpose of their business is to offer post-operative items. And they normally sell it that they're sending you like a box with all the items that you may need to handle your bodies after surgery. Well, there's a lot of fraudulent companies out there. I won't name them, but there's a lot of companies out there that are sending people these boxes that does not include the items that you really need. They're sending you cheaper materials that they want you to use on your body. The boxes does not include what it mentioned or what you paid for. Please, it is super, super simple for you all to compile a list of the things that your doctor recommend that you may need. And you could buy all your items. You could buy them on Amazon. You could buy them in Walmart. You could get them in Target. There's just so many places that you can actually obtain these products versus paying $250 for a post-operative box that does not include the item that you really need, or items that they have purchased to put on your skin that came from probably China somewhere, that is just going to ruin the outcome of your surgery. No, that's not necessary. Do not spend that amount of money when those items that you really need don't even cost that amount of money. Just do your research. If you need me to provide you with the list of the items that you may need, please let me know. Go check my packing video. I know it's extensive, but truth be told, I prefer to have more rather than less. If you have any questions, please let me know. Please try to find yourself a surgery buddy. Please try to get your mind in a great headspace. You are having surgery out of the country. You are leaving your family. You are leaving your kids. You're going to a place that you've probably never been before. You're going to have to put your trust in your recovery house. You're going to have to do research on your recovery house. You're going to have to try to get yourself in a great headspace. You're going to be in pain. You're going to be uncomfortable. You're probably not going to be happy. Your recovery house is not going to be a 5-star hotel. You're going to have to condition your mind to leave the country to have surgery. I know it's going to be hard. Find yourself surgery buddies. Find yourself other adults that may have had surgery with your doctor before. Do your research. Talk to people. Ask people questions. Just try to get yourself as situated as possible before you have to leave. Make sure you have your will and everything in place. I know it's hard to discuss, it's hard to bring up, but reality is, in any surgery, anything is possible. Please make sure you be clear. Please make sure you let your your plastic surgeon know any pre-medical conditions you may have. Please let me know if you have any questions or concerns. Please subscribe, give my video a thumbs up, and this week I will bring you a video on the boppy pillow versus the booty pillow, and whatever else I stumble across. Oh, another thing. Dr. Medina does allow you to get a manicure before your surgery. Dr. Altamonte does not. So, got a manicure. Okay. Thanks, guys. Thanks for watching. Keep on watching, and I'll keep on keeping you posted. Have a good night.